Hello. Hi everyone. I am Dr. Srinivas Kandula, consultant endocrinologist from Care Hospital, Mushirabad. Today I'll be discussing about one of the commonest diseases which I treat and which is also very prevalent in the country, diabetes mellitus. These are COVID times and we all know now the importance of having a controlled blood glucose levels, especially in the diabetic population. Because you have seen that diabetes mellitus patients are very much prone to be infected with COVID, and also we see more deaths in that population too. Like I said, it's very important to discuss diabetes mellitus because not just because it's very common, also the prevalence and incidence of this condition has been on a rise for the past few decades. India is only next to China as far as the number of diabetic population in the country is concerned. So we need to know and check, every individual in this nation need to know the basics about diabetes and how it has to be managed. What is diabetes? Diabetes mellitus is a condition where the blood glucose levels have been persistently high. And why this is important? Why it's important to treat diabetes? This is because left untreated, diabetes mellitus can cause damage to various organs in the body, be it eyes, nerves, heart, brain, kidneys, and cause organ dysfunction. It's very much it's a fact that diabetes is the leading cause for brain stroke, heart attacks, and also kidney disease in the country. And diabetes, along with hypertension, that is increased blood pressure, and cholesterol issues, that is dyslipidemia, contribute to the major morbidity and mortality among various patients. And the reason why diabetes is on a rise is because of the lifestyle changes we have adapted of late. We have been taking unhealthy diet, we have not been exercising properly, and because of this, and also with some contribution from the genetic factors, diabetes mellitus, especially the type 2 diabetes mellitus, has been on a rise in the current generation. Now, why it is important to detect diabetes? Like I said, left untreated, diabetes can affect various organs, and thus it is important to identify diabetes at the very early stage and treat it accordingly. Now, how do you detect diabetes mellitus? Unlike patients who have very high sugars and symptomatic in the sense having increased frequency of urination, having rapid weight loss, or feeling more thirsty, unlike those patients, it's very unlikely to detect diabetes in asymptomatic individuals. Therefore, it is important to screen appropriately the population at risk for diabetes mellitus. Now, which are the population at risk for developing diabetes mellitus? All the individuals more than 45 years of age should be screened by a fasting plasma glucose and a postprandial plasma glucose with or without a HbA1c testing for diabetes mellitus. Not only individuals more than 45 years of age, like I said, because of the current lifestyle changes we have adopted, we get to see more diabetes mellitus in the younger generation as well. So all the individuals with age less than 45 years and who are obese or overweight, or who have risk factors like hypertension, high cholesterol levels, and females especially if they have menstrual irregularities, unwanted hair growth, and obese, and those individuals with a family history, in the sense with either father or mother or a siblings having diabetes, have to be screened at a young age, that is less than 45 years. Along with this, all the patients who are symptomatic, like I said, who have rapid weight loss or increased urination or feeling increased thirst, should be screened for diabetes. But unfortunately, what is happening in this nation is that most of the patients are not screened appropriately at the right time, and they are detected retrospectively to be a diabetic once they end up in hospital for various issues like raised creatinine, that is kidney failure, or heart attack, or a brain stroke. So, like I said, so it's very important for a timely screening of all individuals and treat them accordingly. For the next few minutes, I will discuss the different various types of diabetes and how they are treated. What we see commonly is type 2 diabetes mellitus, which is mainly because of a genetic factor and the lifestyle changes the individuals follow. There are less common varieties of diabetes like type 1 diabetes mellitus, which is mostly seen in very young people, like in the teenagers and in the children, where because of various factors, the insulin is not being produced in the body, and these patients would require lifelong insulin administration. And the third variety is gestational diabetes mellitus, which means diabetes which is detected during pregnancy, and once the pregnancy is over, there is a remission of the disease. That is, there is no more diabetes. However, this particular population of individuals who develop diabetes during pregnancy on a long term are at risk of developing type 2 diabetes mellitus. To enlist the complications of diabetes, various studies have showed that an early and intensive treatment of diabetes in the very early stages would prevent complications. Unfortunately, we get to see many patients ending up in hospital with complications because of inappropriate and less intense treatment of diabetes in the early stages. So, the various complications which the patients with diabetes can develop include diabetic retinopathy, which is damage to the eyes and at risk of losing vision; peripheral neuropathy, because of uncontrolled sugars, the nerves are damaged and patient may have difficulty in walking and difficulty and weakness; diabetic nephropathy, where because of uncontrolled sugars patient has kidney damage and on a long term would end up having renal dialysis, or for that matter even renal transplantation. And in India, the most common cause of heart related issues, be it heart attack, that is myocardial infarction, is diabetes, and also it can as well cause stroke. So what are the various treatment options for diabetes mellitus? Like I said, for type 1 diabetes mellitus, undoubtedly it's the insulin which is required on a lifelong basis for survival. Whereas for type 2 diabetes, with the proper lifestyle changes, that is with a strict diet and exercise program, you along with the help of various oral medications that are available, you can control type 2 diabetes. But type 2 diabetes on a long term also would require insulin in most of the individuals. And in gestational diabetes mellitus, the main mode of treatment is insulin. So that's it, friends, for today. In the next episode, I'll be discussing on another issue related to endocrinology. Thank you.